This is better, yeah.
Okay. Good. Okay, I think we're live, and I think that I am on. Just make sure that I am the spotlight for tonight for the moment, because I'm going to do some introduction to Dr. Klinghardt in a minute, and it's now just after 8:30 p.m. on Friday the 10th of August, so that's UK time. So thank you very much for everybody that has joined us tonight. My name is Mike Berry, and I'll just do a couple of minutes of introduction to what we're doing this evening and also the facility here. So first of all, the facility that we're using is Zoom webinars, and I've added a couple of features for you at the bottom of the chat, at the bottom of your screen. One is raise hands, and the other is chat. So the chat and the raise hands will be handled by myself and Daniela in the background, and we'll be doing it by typing, so that hopefully it will not disturb Dr. Klinghardt in any way, and he can just present and speak to the screen. And you can switch off the chat if you don't like to see it, because it will be on a panel which is most likely on your right hand side, and you can just switch that off when you don't want to see it and just concentrate on the video. Okay, so we're going tonight to be talking about ART Module 2, and before you do that, I just had a quick look actually at some statistics for tonight's registration, because once again we've got a full house, and I just had a quick look because I asked 2 extra questions, which was actually mostly for me, I have to confess, because I was just curious, I'm just being nosy. And I asked 2 questions. One was, are you already a practitioner? And interestingly enough, almost exactly 50% tonight. So we have almost exactly 50% as practitioners and 50% non-practitioners, and a handful didn't answer that question. Interestingly enough, I did this last week to see which countries we had, and last week we had 28 countries. Well, we've topped that tonight. We have 40 different countries joining us tonight, and actually I don't know if I can just rattle them all off or not, so you can count 40, but I have actually typed them and I've written them all here, so I will just read them to you, because there are 40, and I think that deserves an honourable mention, because I know that so many of you are in different time zones, and big respect to you that are staying well out with your normal hours to join us, what is a Friday evening in the UK. So first of all, we have Australia. I won't try the accent. Austria, we have Bahamas, we have Belgium, Bulgaria, Canada, Czech Republic, Denmark, Germany, Ecuador. England is listed as separate as from Scotland and Ireland. Estonia, Finland, France, Greece, Iceland, India, Israel, Italy, Jamaica, Jordan, Lebanon, Malaysia, Malta, Mexico, Holland, or Netherlands, Norway, New Zealand, Poland, Portugal, Qatar, Switzerland, Spain, Serbia, Sweden, Thailand, Taiwan, and of course USA. So wow, you've blown me away already, guys. I'm so impressed. That is 40 by my count, and there are handouts for this evening, and I've made it really simple for you. So the URL that you can actually go to now to download it is really simple. It's a simple PDF, so you can keep along with this, which is klinghartinstitute.com. It's klinghartinstitute.com/ART Module 2. That's the digit 2. Okay, so ART Module 2 on the end of the website, and it's all one word. Okay, and that will give you the free PDF to join us. And at the very end, we have some bonuses and more to give away, so I'll share that link with you at the very end. And without further ado, I would love to introduce now the star of the show, Dr. Klinghardt, and he's going to talk this evening about Module 2 ART. So let me just pass you over to Dr. Klinghardt. The stage is yours, sir.
So I'm trying to share the screen, but something
should be down the bottom of your screen in green, maybe.
I did that.
And then you have to select the right window.
Ah, yeah. Okay. Okay, we're good now.
And you could press play on the green button at the top right there if you like.
Green button at the bottom.
Top right.
Oh.
Select top right.
Oh.
Your other right. But it says slideshow. Down a bit, left a bit, down a bit, down right, straight down from there. Straight down from there, it says slide.
Yeah, we can't see that.
To your right.
On top of it. Oh, we can do slideshow up here. Whoops.
Okay, do that.
Okay. Okay,
Good
we're
job.
good. Very good. Can everybody see me? I think we're good. So hi everybody. Thanks for those of you who stay up at night. On this second course, I will introduce you to the most exciting part of energetic testing that has really revolutionized the world of medical testing. But I just want to repeat a little bit what we did last time. So last time I introduced you to the idea that every medical diagnostic system is deficient. Lab testing, imaging studies, they all have their own flaws and miss a lot. And I explained why we need a different type of test in addition to the current medical tests that are available, which is the medical exam, the lab tests, the imaging studies, and very few other things. I introduced muscle testing as a muscle tone biofeedback test that enhances the physical exam. And in terms of muscle testing, there's several options that we have. There's applied kinesiology. There is Omura's bidigital O-ring test, which I will introduce completely today. And there is a few other more esoteric ways of testing. And then, of course, there's electroacupuncture. There is the using skin resistance as an indicator, which unfortunately can only measure changes in the sympathetic nervous system, but misses out the parasympathetic nervous system. Just as a conclusion of this, I did my thesis on the autonomic nervous system, how it interrelates with the immune system, and this was over 40 years ago, and kept track of that. So I consider myself as a specialist in the autonomic nervous system, and realized very quickly that the changes in muscle tone that we're assessing, either with the straight arm test or applied kinesiology, breaking down all the different muscles in the body, or using the finger muscles, which I will introduce today, that the changes in muscle tone that we're interpreting are caused by the interaction of the autonomic nervous system with the so-called motor matrix. And I explained that last time in detail. And today we know that there is a third equation that goes into this, not just the sensory and motor innervation of the muscles, not just the autonomic super innervation of it, but also the change in the state of the water in the muscles, which is the work of Dr. Jerry Pollack in Seattle, who has become a close friend and acquaintance and is guiding me in much of my thinking. So today I want to introduce you to the incredible, creative, scientific, deep work of my mentor, a man that I hugely respect, Professor Yoshiaki Omura of New York. Professor Omura was raised in Japan, was an engineer in his first profession, then moved to the US, became a medical doctor. He was the one who introduced acupuncture really to the medical community in the US, and was kind of famous in the first few years. This is now looking back in the 70s, where he introduced the possibility of doing anesthesia doing major surgical procedures while just simply stimulating several acupuncture points with microcurrent through acupuncture needles, and that kind of put him on the map. And I want to take you through this and then take you into the O-ring test that he developed, which is a development completely independent of Dr. Goodhart's applied kinesiology. And until today, I have to say this, the bidigital O-ring test and the proper science behind it was only available to licensed medical doctors, has never been made available to the general public. And I know I'm stepping in a dangerous area with this, but it is important that this method will be available to everybody, because it will change the way medicine is practiced in the future. So here we go. So first of all, just a brief look at some of the medical literature. I will give you a lot more later on. So first of all, Dr. Omura published a book called Acupuncture Medicine, his historical and clinical background, that was republished in 2003. The first edition was much earlier. And so it is the standard text that reviews how old acupuncture is. And it's actually only 2,500 years old. It's not older than that. And then I have a literature site here that shows that the bidigital O-ring test that we will look at today was awarded a US patent in 1991. And in order to get a US patent, you have to produce proof of what you patent is actually working, and you have to go very, very deep, much deeper than in any scientific study. And he did get the patent. That was not possible for applied kinesiology. It was not possible for anybody working with a pendulum or dowsing rod, and it certainly was not possible with electrodermal screening, electroacupuncture. So what I will show you briefly is also published. It's called An Introduction to the Basic Technique and Theory of the Bidigital O-ring Test, in the American Journal of Acupuncture, published in 1996. I will take you through the details, but if you want to read the full article, it is certainly there. And then the fourth site that I have here was an interesting experiment done at a university in Japan, where they actually used an instrument to measure the change in muscle strength. And that was very significant for us to see that actually the O-ring test works also with a machine without using your subjective own muscle strength by pulling on the fingers. So that was also awarded a patent. And then I put one of the articles down here that was a landslide article in Our Medicine. And I just read the title: Abnormal Deposits of Aluminum, Lead, and Mercury in the Brain, particularly in the hippocampus, as a main cause of decreased cerebral acetylcholine, electromagnetic hypersensitivity, pre-Alzheimer's disease, and autism in children. This was all based on work with the O-ring test. And I want to point out here that it was only this year, in 2018, so 18 years later, that Chris Axley proved a dramatic increase in aluminum in the brains of autistic children. Omura already demonstrated that almost 20 years ago in a study presented at the university in Tokyo. So here we go. So the O-ring test, I'll just show you briefly from the abstract that is published, 2 ways of using it. One, you see the picture on top. You see a practitioner pulling on the fingers of a client, and the client is putting his hand, in this case, over the spleen area, or it could be the splenic flexure of the colon, and the practitioner assesses whether touching this area of the body changes the strength in the finger muscles. The picture below shows the option of testing that we prefer. It's called indirect testing, where the in-between person uses a glass rod to point at the spleen of the patient, and the practitioner actually tests changes in the muscle on the in-between person. It has nothing to do with the patient. This is called indirect testing. We will not go into that deeper today, the indirect testing method, but it is a leading method that has hugely stepped up the validity and reliability of energetic testing. And so here we go. What is he doing with the fingers up there? So I will show you the picture in detail now. So in figure 1A, you see the two hands on top. These are the hands of the practitioner that make rings between the thumb and the index finger, closing it to a ring. And the patient is making a ring also with thumb and index finger of the non-dominant hand. And the practitioner is trying to pull the ring apart. And you see the same picture here for looking down from the top. So the index fingers of the practitioner are diving into the ring from the top of the ring that's offered by the patient. And here's another view where the hands of the practitioner pulling apart the ring that the patient makes between the thumb and the index finger. Now, there is a process called calibration where that will be explained in the brief video that we prepared. I think, yes, it's the next part of this presentation is a short video introducing you fully to all the details of this type of test that you need to know. So Mike, you're on to put that video on. Let's hope that the gods of the internet are with us.
Okay, so I can do that. Let me just stop sharing your screen now, and I'll share my screen, which is here.
Stop share. Should I do stop share? I guess so.
It should automatically pull yours off anyway. So,
okay.
And hopefully you can.
Yeah, the comment is people do not hear it either.
Okay, I'm sorry.
So shall I just comment on it?
Yeah, I'm just going to mute it in that case. Yeah, I'm just going to mute it in that case and just let it play. I'm really sorry. I know why it's doing it is because it's trying to pull in the audio from me and not from my computer automatically. So
I'll be sure that people can hear me.
Yes, I think so. I can hear you perfectly.
Okay.
Let's check the chat box.
So let me talk through because we are already at an important part. So
okay.
The patient makes a ring between thumb and index finger and offers it horizontally. And not like that, that's how the monkeys do it, but fingertip to fingertip. This is directed by the prefrontal cortex. That's only humans can do opposition of the thumb like that. It is dependent on the last edition of our brain, some part of the prefrontal cortex, which is where our higher consciousness resides. It's also the most vulnerable part of the brain that controls that to toxins and to infections. So the ring is offered roughly at the height of the celiac plexus of the practitioner, and it should be offered horizontally. Yeah, not at an off angle. Yeah, but for demonstration, Daniela may angle the ring a little bit so you can see it better. And the practitioner pulls the ring of the patient with two similar rings that the practitioner makes. And you're diving in with your index finger from the top into the ring. And you hold it close to your body, not far away like that, but close to the body at the height of your hara, of the celiac plexus. And you pull with moderate strength. And in this case, I'm not able with moderate strength to pry her fingers apart. You know, and you see the angle of my forearms, they are pulling apart, the elbows apart, very close to my body. That's where you have the greatest proprioceptive feeling. So now we go to the next finger, the middle finger, the ring that she makes between thumb and middle finger, and try to pry that apart. And in her case, I'm not able to open that ring. Then she goes to the next finger, the ring finger. Yes. And again, I try to pull it apart with moderate strength. And in this case, I'm able to open it up. So it is important to know that in normal neurology, if she has a normal neck and normal nerve supply to the hand, that the ring between the index finger and the thumb is the strongest, and each subsequent ring gets weaker. So the thumb and middle finger is weaker than the thumb and index finger, and the thumb and ring finger is weaker than the thumb and middle finger, and the weakest ring is the one with the little finger. Yeah, that is important to understand the whole testing procedure, as you will see in a moment. I don't know what wise words I'm saying there, but I'm sure it was important. So the sequence of strength. Now, if there is abnormal sequencing, you may have a neck injury, and then the test cannot and should not be used. Yeah, so let's say if the ring between the middle finger and the thumb is stronger than the previous ring with the index finger, you can and should not use this person's hand for testing, because you will get wrong or unreliable results. First, the neck needs to be looked at and fixed in the patient, and if possible, then they can be corrected, and then the ring can be used. For this reason, we prefer the indirect testing, where we can use a healthy person without neck injury and insert that person between the patient and the practitioner. Okay, so now, in her case, the first ring that was weak is the thumb and ring finger, and the last finger before is the thumb and middle finger that was strong. And so I used the last ring that was strong to test her organs, in this case her brain, her tonsils, and there it opens up. You cannot see that very well here, but the tonsils are very often a chronic interference field, and so in her case we used the thumb and middle finger. That was the last strong ring before the weak one that we used to detect places in the body that are dysfunctional. So in her case, it was the tonsils, and we could go through all the organs, and most likely we would not find any other weakness in her. So you may have to review this video a few times in order to see that. We will make sure that you get the original version with the original text, because there is some mathematical issue in here that is not so easy to learn for everybody. Now, if you want to find something that gives the patient strength, like a supplement or food, we use the first ring that goes weak. In her case, that would be the thumb and ring finger. Yeah, and so she's holding something in the hand right now. I forgot what it was. And yeah, it's sad that we don't know the original text.
I think that was sprouts from memory.
Okay, so yeah, so when we test supplements, we give them patient in the hand, and we want to find something that gives the patient strength. But that's not enough. We're pulling with the thumb and index finger. In her case, her hand, I'm pulling the thumb and the ring finger, which was weak before. And now when she holds a supplement or a food that gives her strength, I will no longer be able to open the ring. But then I can see how strong does it become, and I can pull with 2 fingers. That means with my thumb on one end and the index finger and middle finger on the other hand. And if it still stays strong, we call that now a 2+. And then I can pull with 3 fingers. That means I'm adding in my ring finger also. That would be a 3+. And if something really makes it phenomenally strong, I can pull with all 4 fingers and the thumb. And if I can still not open it up, that would be a 4+. So this test is the first energetic test that not only qualitatively allows you to test, but also allows you quantitatively to test. And I know it's a little bit difficult now with the video situation to understand all that, and you may have to practice this with a friend, and you may have to review this section a few times. So in the video, it's going to be more clear. There's going to be some things that weaken you. In order to find out what weakens you, you use the last ring that was strong before the weak one. And then in order to find out how weak it makes you, you first pull with the thumb and index finger. And if you can pry the last strong ring open, that's a 1-. But then you can use your next weak ring with the thumb and middle finger and pull, and if you can still open, it's a -2, and so on and so forth. So you can grade how weak something makes you and how strong something makes you. And we, in our patients, we test every patient for the main foods they're eating to find out which foods give them strength, which ones are neutral, and which ones weaken them. Now, admittedly, there can be changes throughout the time of the day. For example, coffee may give you strength in the morning, but if you drink it at midnight, it may weaken you. And there is certain foods that fit into your circadian rhythm, and others won't. And so you also have to be aware of the time of the day. Now, in this last demonstration, I show briefly what's called the direct resonance phenomenon. I use a mercury thermometer to and wave that in front of her head, and if that opens the O-ring, that means the last ring that was strong before the weak one, there is resonance between the mercury in the thermometer that I used and mercury in her cranium or in her brain. And if I find that, I can localize mercury deposits in the body, and I can use the same principle for any toxin, for glyphosate, for lead, for aluminum. I can also use it for infectious microbes. If I have a culture of strep, I can localize them to see what part of the body resonates with them. That means the O-ring test opens up if I hold the strep culture in front of that organ that has strep in them. We will get later in the modules back into this to demonstrate the direct resonance phenomenon. This is just a quick preview of that. This is just simply demonstrating the body position. So when we use the O-ring test, we never stay front to front, body to body, but we open the angle between us so that I'm slightly looking past the patient and the patient looks past me. And I don't know, I'm not sure if you're repeating the video here or if that is the end of the video.
podcast, yeah.
We're not at the end yet, but would you like me to just stop it?
Yeah, because I don't know. I know that it's the end of the demonstration.
Okay.
Let's go back to the PowerPoint, if we can find that. Do I need to share screen?
So yeah, you're back on yourself again now, and it's now down to you. You can share the screen. What I have done, just for the sake of interest, is I have actually already put that video with audio into the bonus page, and I'll share the link again at the end, so everybody can watch that video live.
Okay, so people will be able to see that today?
Yes, I've already done it, and it's already there on the bonus page. I'll share the URL at the end, and yes, they'll be able to watch it immediately.
Okay, so what I would like to do, first of all, of course, the idea is to give you enough information and enough visual also that you can practice this at home. This is like playing piano or playing a violin, that on the first trial you may fail, and it will take a few days or a few weeks, sometimes a few months, to get really comfortable with the test. But I want to give you a preview now what you can do with that. And this is all published research in peer-reviewed journals. So I just highlight here a few things. So this second article here from 1982, and I want to point out that Omura started publishing on the O-ring test in the late 70s, all the way through 2015. And so the first one from 1982 shows what I briefly tried to show in this test, by finding the tonsils of Daniela as being an abnormal part of the body. Yeah, and so this shows very clearly the study that any abnormal part of the body you can immediately identify with the bidigital O-ring test, which is not different from applied kinesiology, but what is different is that you can quantify it, and the solutions that are offered are very, very different. I'm just going to take you through a few of my favorite studies. So one of the studies here is about the fourth study down on the page, shows that you can replace laboratory tests with the O-ring test. The beautiful experiment that we did in my practice is I made, together with a pharmacist, we make sugar solutions that are in the range of normal blood sugar, but also going down to the hypoglycemic range and to the high elevated range of blood sugar. And within 5 points of the testing scale of normal lab test, we could accurately use the direct resonance phenomenon, simply placing a vial of sugar over one of the same vein that you would use to take blood. So we put the vial over the vein, and if we elicited the direct resonance phenomenon, it means resonance between the concentration of dextrose in the vial and in the vein, we could accurately predict the blood sugar level of the patient without ever having to poke the patient, which is a phenomenal potential in that. We can do that also with neurotransmitter. We can localize neurotransmitters in the brain and the tissues in the autonomic ganglia. And what Omura demonstrated beautifully, we can demonstrate the increase of neurotransmitters in an acupuncture point after sticking an acupuncture needle in the correct point. That is in that particular study from 1987. A beautiful article from 1985 shows that basically the O-ring test allows us to image where the internal organs are. The principle is simple. We take a slice, for example, an anatomical slide of heart tissue, and we can move it over the body in the heart area, and wherever the tissue in our slide is identical with the tissue in the body, the O-ring test will open up. And so we can mark exactly where a particular organ is. And that, of course, can be then transferred to the same principle testing cancer. by using, for example, a slide of pancreatic cancer. And if we move that over the body in the area where the pancreas is and the O-ring test opens up, then we know the patient has pancreatic cancer. Of course, that requires a little bit of having experience with the test to not overdiagnose cancer, which is a risk for the beginner. But basically, there's no limits what we can localize in the body. We can localize cancer tissue. We can localize where healthy organs are. We can localize mercury under a gold crown. We can localize lead in the bones. We can localize Lyme disease in the heart or in the kidney, and so on and so forth. Omura did a beautiful development in the early 90s where he was questioning the reflexology charts that are available. So in reflexology, there is a map, of the feet that a certain portion of the sole of the foot is supposed to relate to the liver and another one supposed to be to the kidney. And he found simply by using organ slides, for example, of the liver, anatomical slides, and then moving it over the sole of the foot, and wherever there was a direct resonance between the organ and the area of the foot, he knew that truly is a representation area of the liver, and found that most charts were completely wrong, completely off. He did the same with the hand, he did the same with the tongue, and with other microsystems in the body. A development in the late 90s is that Omura works together with a Japanese university that creates all the testing slides for him. And so with one particular development, he was able to measure the length of telomeres in the DNA of his patients. And we know that the telomeres are basically a representing your age. The shorter the telomeres get, the closer you are to death. And when they're really short, you die. And so he was able to measure the telomere length non-invasively and then could predict what medical intervention would lengthen the telomeres. And he found, for example, certain acupuncture points were able, when they're needled accurately, to lengthen the telomeres. And he found some other techniques. In this next study down, the second one down here, really Mike, your picture is in a way, but he shows how we can accurately localize parasites in the body. And some of you who are my patients know that by using the O-ring test, we were able to find larval stages of parasites in the brain of many of the kids with seizure disorders. We find larval stages of parasites in the heart and other tissues where they're not commonly known to be. And then treating them, of course, sometimes we can have dramatic positive treatment results. The third study down here I highlight because in Japan, one of the more common cancers in Japan is gastric cancer. And Dr. Shimotsuura, who is a very, very well-known medical doctor in Japan, uses the O-ring test as a simple way of screening the patient for stomach cancer, and showed that he could do that very, very effectively. There is no false negatives. There is a few false positives. That means the O-ring test is more sensitive than the commonly done biopsy or other imaging techniques that are done. And then we go on the list, of course, for chronic intractable low back pain, Omura often found the herpes viruses really being at the core of it, especially herpes zoster. And you cannot do that with any medical treatment that you can actually localize in the sciatic nerve active herpes zoster. But with the direct resonance phenomenon with the O-ring test, you can do that. Again, one further paper that shows that especially with the correct cancer slides, anatomical slides of cancer tissues, you can find early on cancer in different organs, and then can initiate the medical cascade of studies, blood tests, and imaging studies to track it down. And of course, we are proud of that we can very often early on detect malignancies, and then are successful with just treating with herbs and vitamins before it becomes clinically evident. And of course, the earlier you detect a cancer, the easier it is to treat with non-medical treatments that are often more effective than the medical ones. Good. Here another paper from early paper from 1985 that shows that we can identify not only what bacterial infection a patient has, but we can identify where in the body it is, and then we can screen the patient for effective antimicrobial agents. And not only that, but also their optimal dose. And then, as I will mention later, we can check for drug uptake. That means we can use the O-ring test to detect whether the antimicrobial agent actually is taken up in the body part where the infection is. Okay, so Omura already in the early 90s mentioned the dangers of Wi-Fi and the home environment, the electromagnetic home environment, the cellular phone, the color TV, the microwave oven, and so on and so forth, and linked it to the development of cancer. He showed very, very clearly that the more cumulative sources of electrosmog you have in your home, the higher your risk of developing cancer. Okay, and then an issue that has haunted us in the last few years, we had one patient, a young woman with most severe overall allergic reactions. She could only eat 3 foods. She weighed like 60 pounds or 70 pounds, was a normal sized person, 5'5" or 5'6". And with the O-ring test, we found that she had surgical metal clips in her abdomen. And we received her surgical report from hernia surgery, and it said no surgical clips were no metal clips were used. So we did an X-ray, and we found metal clips in there, even though it was denied by the surgical report. And so it took a whole year of finding a surgeon to agree to remove the clips. And we finally did that, and when that was done, the patient had a dramatic improvement in her general condition. And so Omura already in 2001 published a similar case. Yeah, that's the top study here. That's actually, sorry, it's not by Omura. It's one of his students that's the lead author of the study. Okay, and then the second study here is that Omura's bidigital O-ring test is phenomenally effective in acupuncture, that you can actually localize which acupuncture point should be needled today, and the exact location of the point can be determined that way, and also the needle depth and the length of stimulation. Good, and then the study below here, the diagnosis and effective treatment of intractable pain, infection, and cancer using the O-ring test for that. So I already mentioned the top study here that Omura could use a slide, for example, of healthy liver tissue and do direct resonance over the tongue, and found exactly where on the tongue the organ representation area for the liver is. Completely different from the published ones, which are all assumed connections that are not true. And when you actually have the right representation area on the tongue, you can stimulate it either with pressure or with a needle or even with essential oils and get dramatic results. Yeah, and then this was the biggest breakthrough maybe in our medicine was in 1994, a study by Omura and Ishida that shows that you can, for example, if you give somebody, let's say, an antibiotic, let's say you give somebody Zithromax for, let's say, an infection in the lung, and then you give the Zithromax, and then what you do with this test, you do direct resonance with taking a small amount of Zithromax and hold it over the lung and see if the O-ring test opens up. If it opens up, that means there is Zithromax in the lung. But if it doesn't open up, it's not in the lung. It may be in your thigh and in your buttock, and it may be in your foot and in your hand and in your face, but it may not be in the lung. And then it can, of course, not work. And then with the O-ring test, it's possible then to find out what is needed to make it go into the lung. And this usually is an acupuncture point, or in neural therapy, the injection of a scar, or it's an infected tooth that's blocking the uptake in the lung. And so this is called the drug uptake enhancement or drug uptake blockage. And that's a huge issue in our medicine that has moved our medicine light years ahead of anything really. You know, if you give somebody a cancer drug and it's taken up in the body everywhere except in the cancer, it cannot work. And then we can find out with the O-ring test why it's not entering the area, and then we can guide it there through some simple intervention that, of course, we show in our workshops. This is more like in the hands-on workshops you will learn that, but we will guide you in these courses as close to it as we can. I'm just trying to water your tongue, and I hope you recognize some issues here that are phenomenally important. And to use the O-ring test is that simple once you actually mastered the technique of the O-ring test. So here is again a beautiful article that you wrote in 1996. Significant mercury deposits in internal organs following the removal of dental amalgam. So we see that every day. Amalgam fillings are removed. They're removed incorrectly. A lot of mercury is evaporated from the drill that's used and then settles usually in the brain and the hippocampus, in the memory center of the brain, in the spinal cord, in the pancreas, in the kidneys, and so on and so forth. And of course, with the O-ring test, we can immediately scan the body and find out where the mercury is and what is needed to remove it from there. Yeah, the resonance phenomenon between two identical substances, that is what I showed in the brief video when I hold a mercury thermometer over somebody's brain and the O-ring test opens up. That is the resonance phenomenon between two identical substances. That means there is mercury in that brain and it needs to come out. This is an article that has changed my life. The one on top, the role of mercury in resistant infections and effective treatment of chlamydia trachomatis and herpes family viral infections. So basically, Omura showed in this work that mercury potentiates the growth of certain pathogens in our system, and that's all the herpes viruses. That's Epstein-Barr, herpes type 6, herpes zoster, herpes simplex, and so forth, but also the chlamydia trachomatis, that's the genital chlamydia type, becomes completely resistant in the presence of mercury in certain body compartments. And so then the treatment of the herpes infections and chlamydia will always include removing the mercury from their tissue. And again, with the O-ring test, it's going to be very, very simple to find out where's the mercury, where's the herpes, where's the chlamydia, what treatments are needed to get it out, giving the treatment, checking for the drug uptake of this particular item that is given, and making sure it gets to the area. And then we're not only, of course, removing the mercury, but then doing reasonable, simple treatments for the infection and for the viruses. Good. So let's go on to, there's a beautiful article here on the bottom that reads, dental treatment for dizziness and joint mobility disorder caused by harmful electromagnetic waves. That's an an article where they use the O-ring test to identify that the dental fillings, the metals in the mouth, were turning the teeth into an antenna for electromagnetic waves that concentrates the electromagnetic waves into the central nervous system, then being responsible for chronic dizziness and TMJ disorders. I don't know if I should take you through this now, but there's a couple of other exciting things that I've seen with Dr. Omura's work. He identified, there is a Japanese colleague or friend, really high school friend of Dr. Omura, who has a cancer clinic in Japan. And all he does is that he identified that a few minutes after sunset and a few minutes before sunrise, there is a special energy present on the planet in that area that is deeply healing. And so Omura found that the carbon and simple cardboard paper can be used to store this energy. So he basically has a pack of cardboard papers wrapped in aluminum foil, and then he identifies with the O-ring test when this particular phase of the sunset is, then opens the aluminum foil, exposes the paper to that, and closes it a few minutes later when that phase is over. And when he takes that paper, and we've done that since 20 years now, since I've learned this test, when you take the paper, take it out of the aluminum and put it against a painful area of the body, there's immediate pain relief, but you can also use it for cancer with dramatic improvements for cancer. But this is sort of like stretching it a little bit for some of you right now. And I didn't want to get too much into the more weird applications of this. So Omura since 1991 already did a huge amount of work on the harm of electromagnetic fields in the bedroom or workplace and so on and so forth. I just wanted to show that here. And beautiful work on acupuncture using the O-ring test to identify, for example, where stomach 36 really is. It's never in the place where the books say it is. It's always slightly off to the left or right or up or down. And if you stimulate the true stomach 36, as he calls it, he found there's dramatic changes in the lab work of the patient, which he documents in this study, that shows that triglycerides come down, homocysteine normalizes, the CRP or other inflammatory parameters in the blood normalize simply by the stimulation of the true stomach 36. And in order to find the true stomach 36, you need the O-ring test. You simply palpate the area with a needle until the O-ring test opens up, or you use various neurotransmitters in dilution and see over which area in that area you get the direct resonance. So that's something for the advanced work that I show in my advanced practical workshops. Okay, so let me see the medical and dental problems associated with amalgam. Again, beautiful article at the bottom from one of his colleagues, a collection of electromagnetic waves in a dental implant. It shows that basically titanium implants concentrate microwave into the jawbone, and an absolute disaster. The second article here shows that the O-ring test can be used to find the proper plane of the bite that so many people are struggling from. The article from 2015 shows electromagnetic waves collected by dental amalgam filling. There's actually wonderful new studies that show that when you expose an amalgam filling to a cell phone, that means you make a phone call close, you hold your phone while you're on a phone call close to an amalgam filling, it dramatically faster evaporates the mercury that's in it than it would otherwise. So they already found that 3 years ago. And then here on top, one of the ways we're screening for cancer with the O-ring test by using from a Japanese university, a preparation of what's called integrin alpha-5 beta-1 that allows us to very accurately localize cancer in the body. But we're not going too deeply into that today. Beverly Rubik, some of you know her. She is sort of the master physicist who published a beautiful book, but also this article on the biofield. And some of you who do the advanced work with ART with me know that we're working with the biofield very extensively in very sophisticated ways. And Beverly Rubik was one of my mentors, and Dr. Omura was one of her mentors. So just for those of you who are read up in this area. So the study on the bottom here shows involvement of the pineal body in the biodigital O-ring test. So just quickly give you the gist of it. It was 1994, 25 years ago. Basically, Omura tested a patient, very accurately found the weak spots in the patient and solutions. And then he blocked the representation area of the pineal gland on his own forehead with aluminum foil, and he could not find anything anymore. Then he did that on 20 other people, 20 other testers, 20 other physicians with the same experience. When you put aluminum foil on the forehead, the muscle testing phenomenon completely disappears. And we also did that with applied kinesiology. So there is something on your forehead, an area that we usually refer to as the third eye, which is simply the representation area of the pineal gland. If you block that with metal, you can no longer muscle test. Just take it or leave it. Bone marrow malignancy you can accurately find with the test. The papillomavirus. And then a beautiful study on autism that he did. Actually, in the fetus, we can already check for levels of aluminum, mercury, and titanium dioxide and asbestos in the fetus and can predict which child might become autistic. Okay, I think I'm going to leave it here. So let me just sum up what we were supposed to experience today. So our video was supposed to give you a brief, simple instruction of how to learn the O-ring test. With the studies I showed you, I wanted to whet your appetite what you can do with the system. Now, you don't have to remember much of that. What I do want you to do is practice the O-ring test after this talk, to use it first for food allergies and for the health of foods. I want you to be able to test your breakfast to find out whether it actually strengthens you or weakens you, whether coffee or tea is actually good for you or bad for you, or what brand you're using is good for you or bad for you. Does it strengthen your O-ring? Does it weaken your O-ring? Do that with everything that passes into your mouth, whether it's a vitamin, a supplement, a medical drug, or a food. Find out on a scale from 0 to 4 if it's positive or on the negative side. And if it's on the negative side, consider leaving it out. That's really what I want you to accomplish after this talk. The applications of the O-ring test are vast, but to give you a look in the future, we use the O-ring test as part of our armamentarium, and many of the things that Omura does with the O-ring test, we prefer to do with a straight arm test for very good reasons. And so I will take you in the next modules through breaking things down, which test is the most appropriate. So in terms of the future, we do most of the things that I showed you the studies today for, to find toxins in the body, to find infections in the body, to find solutions we do with a straight arm test, which you will learn. But to test foods and supplements, the O-ring test is absolutely the ideal test. It's the quickest the quickest way to get to the solution, and it has revolutionized certainly my work, but also the work of pretty much everybody who's been in contact with Dr. Omura. Those of you who are medical doctors are invited to attend his meetings. He does not allow non-medical doctors to attend his meetings, so I want you to respect that. But those of you who want to experience a living genius, please do see him. He gives his meetings in New York several times a year. Thank you very much.
Okay, so can we just stop sharing your screen just now? Is that possible? If you hover your mouse over the top, I think you'll be able to stop that. There you go. Good job. So you're still on. I've still got your camera on. And I think might be practical to maybe ask Daniela if we have any questions that want to be answered just now, Daniela.
I have some questions. So let's see. The first one was, how strong do we want the product to test? Is it okay 2 or must be 3 or 4 or more?
Yeah. So I tell you quite honestly how we're using the O-ring test. So I've looked very carefully into the genetic testing that has become available in the last 10 years, through the 23andMe and other outfits. And basically, what we did, the suggestions that come out of the genetic testing and out of other lab work that we do, when you do the intracellular level of different vitamins and hormones and so on and so forth, most people will get a long list of suggestions of 50, 60, 70 different things. And so we then use from our test kit, test all of those 60, 70 things. And a few of them will be a 4+. Many of them will be a minus that actually block the patients or test negative. Many of them will be neutral, that means not interesting. And there will be a few 2s, a few 3s, and a few 4s. And so the way we then proceed, we put the 4s on the patient altogether and make sure that it's still a 4, that there is no negative synergistic effect. Sometimes we have to take away 1 or 2 of them to keep at the 4 level. And then we adding in there's a tapping procedure that we will teach you where we bring the system back to normal. We have the force in the system, but in terms of the strength of the O-ring test, we bring it back to neutral. And then we're adding in the 3s and see if one of them is still testing as a 3 or 4, and then we will add that in also. Very rarely we will add in a 2 or a 1. That's usually will be if the patient is really scared to give up one of the supplements, then we will compromise. And if it's on the positive side, we let the patient have it. But the issue that you need to be totally aware of is the area in the small intestine where we actually are absorbing nutrients is relatively small. And all the nutrients that we give compete for uptake, which means that the more you give a patient, the less uptake you get of the important things. They're all competing with each other. And so we're trying to minimize the amount of things that we give to people, and we like to limit it to a few of the 4s and are really, really careful not adding anything that doesn't add anything to the pie.
Okay, so then they want to ask, in case of pancreatic cancer, if you don't have the slide of the cancer, how do you test it?
Yeah, so in case of pancreatic cancer, of course, is one of the more scary cancer, first of all, because the prognosis usually is pretty bad at the time of diagnosis. And there's a huge link to parasites with pancreatic cancer. Very often it's the long-term result of undetected parasites or undertreated parasites, where they're escaping up the pancreatic duct into the pancreas for safety. The pancreas is also very, very vulnerable to environmental toxins, especially glyphosate, herbicides, pesticides. So I need to be careful what I say in terms of cancer diagnosis here for obvious political reasons. I use integrin alpha-5 beta-1 as my detection instrument, and that has been very good. And we sell, you can obtain from Klinghardt Institute a complete test kit for the cancer slides. It is expensive, I'm warning you, but we have a complete test kit that includes pancreatic cancer. And so I cannot tell you a cheap way to bypass that. You can push on the pancreas, and if there's no stress signal, most likely there is no problem with the pancreas. Yeah? So when you can localize it accurately anatomically and you're stressing it and there is no problem with it, most likely there will not be cancer in the pancreas. There can be pain in the area, which usually will be the stomach. It's much more likely, or the colon or the spleen. Yeah, they're all overlapping in that area.
Right. So how do you clear block regulation with the O-ring test?
How do I clear blocked regulation with the O-ring test? Okay, so first of all, we haven't talked about blocked regulation yet in this context of these short seminars that we do. But the way Umura bypasses the problem of block regulation is by counting down the strongest ring to the next weaker one, to the next weaker one, and operating in the area between the first one that goes weak and the last one that goes strong. That bypasses the problem of block regulation. Not totally, but you can still get to the most important issues that way without unblocking the patient. And by, in succession, treating the important issues that show up with the O-ring test in that way, you will eventually unblock the patient in our other system of thinking.
There is a question about switching, but it might be a little bit more advanced for what we are explaining now.
Yeah, switching, just one brief comment. So Umura was invited in Germany in the 1970s by the leading energetic practitioners. Germany was very advanced after the Second World War because there was no money. People were poor. And Germany has a large history of dowsing and energetic testing. And so that's where electroacupuncture evolved. And my mentors in Germany, Dr. Voll, Dr. Gleditsch, Dr. Kramer, all the big names, and they heard of Dr. Umura, and they were excited in getting him to Germany. So he came there in the late 70s, and they were testing him on a brain cancer patient to see if he would find the brain cancer with his O-ring test. And so he did find the cancer. He found the right cancer type, but he localized it on exactly the wrong side of the brain. And so my German mentors dismissed Umura and kind of said, well, that's bullshit. You know, he can, you know, yes, he can find the cancer, but if he doesn't find it on the right side of the brain, it's not what we need. And so this is another way of saying that Umura didn't know about switching, and switching is not part of the O-ring protocol. It is part of the ART protocol very early on in the testing. And those of you who've done the ART workshops with me know how we test for switching, but that will be part of this curriculum in these modules where we go through switching and the importance of it.
Right. I think we have, we do one more. Somebody's just wondering about what you can do with switching and blocking, as you already explained, and if you can bypass that if you are self-testing.
Well, the O-ring test, the way I'm introducing it here, is a scientifically validated test. And the O-ring test, to properly do it, is an indirect test. That means a in-between person holds the patient by their arm or by a body part that is not injured, and then the practitioner induces stress signals in the patient, for example, by holding mercury in front of their brain. And that stress signal that's initiated is conducted electromagnetically through the in-between person and elicits changes in the person that are identical to the changes in the patient. And those are then read by using the O-ring test of the in-between person. And this is the only way the O-ring test is validated and is highly reliable and valid in that way. We have not found people using the O-ring test by themselves to get reliable and reproducible results. We will show in one of our modules how to self-test in a reliable way. But this is not using the O-ring test by yourself, on yourself, will not give you reliable results. You will find what you expect. You will not find what truly is going on. Let's do maybe one more.
Okay, so there is a question about hair testing, hair analysis, doing ART with hair analysis.
Doing ART with hair analysis. So I don't quite understand the question. So hair analysis, just in general, hair analysis shows whatever minerals and metals the glands in the hair push out into the hair. And there is a vague relationship between methylmercury and what comes out in the hair. So if there's no mercury coming out in the hair, that means it was not in the blood before. However, the shortcoming of that is, for example, in autistic kids, they always look beautiful in terms of their hair analysis because they're unable to mobilize mercury from their brain and from their central nervous system to get it in the blood. And it has to be in the blood before it gets to the roots of the hair, before it can be pushed in the hair. So the hair analysis is a much disputed test in medicine. It is validated now for lead toxicity and only for lead toxicity, but none of the other things have ever been passed through the courts of medicine, and it's commonly used. And so the hair may show what has cruised through your blood. It's about 6 weeks for an inch of hair. Some people grow it faster, some don't grow it at all. But it's roughly assumed 1 inch of hair, the one closest to the scalp, represents the last 4 to 6 weeks. And if that's cut off and sent off, it shows what was in your blood during those 4 weeks. But there is almost no relationship between what's in your blood and what's in your bones, or what's in your eye, or in your hippocampus, or in your inner ear. So hair analysis is for me, it's a nice test to demonstrate to patients, yes, you have a problem. And it may have some validity in terms of testing mineral content in the body. We do want to see normal levels of the healthy minerals in the blood, but the mistake in hair analysis, if it doesn't show toxicity of a particular metal, it does not mean you're not toxic with that metal. So it's greatly misleading. And the O-ring test will always show you where your metals are and in what concentration. And it's a unique test that supersedes all other available medical tests in that way. We have, just to run through the list in terms of other tests, we have the challenge tests for heavy metals, where we inject EDTA or DMPS, DMSA into the blood of the patient, then collect the urine. And again, that can only show what on this day this particular agent can mobilize and what's mobilizable, and usually has to do more with what's in the kidneys or the blood vessels of the kidneys. Doesn't have to do anything with the brain, what's in there. Then you have the porphyrin tests, which are a little bit more reliable. And there is very, very few tests that really have significant meaning. in terms of medical diagnostics, and it has to do with the fact that conventional medicine that controls the money in medicine has not sought out to create more reliable tests, like a functional MRI who could show metal deposits in the brain and so forth. So basically, the O-ring test gives us what the functional MRI will eventually be able to give us, but at a cost that will not be affordable for most people. Do you have any more?
Yeah, it's just that there is a little bit of concern by someone that says that there is somebody online saying that you do hair analysis, or that people get their patients to send hair samples to them, and the practitioner says, "Did you test the hair with ART?" I don't think this is possible. You don't do this.
Well, you can do direct resonance on the hair, absolutely. You can do direct resonance on any. I can take a stone that you bring me, and I can tell you if there's mercury or lead in the stone. You can give me your hair, and I can tell you whether there's lead or mercury or aluminum in the hair, absolutely. But, you know, we don't want to, hair analysis is simple and cheap. And so that's one place where I would not waste my talents on trying to replicate an inexpensive medical test with an energetic test. You know, where there is good testing available in medicine, I use that. But how you interpret the hair analysis is a whole other issue, and it's kind of a sad story. Yeah, let's put it that way. It's a valuable test if you know the limits of it.
I think we are done. I just wanted to share that there are many people that are really appreciating your webinar tonight.
Yeah, I apologize for the glitch with the video,
a lot of positive.
but I do urge you to see the video and see it over and over until you get the simple and beautiful, intelligent system that Professor Omura has created for us. It is a revolution in medicine, and in order for us to go forward with these modules, please digest this one. Not so much the studies I showed, it was just to show you a little bit into the future where we're going with this, but do understand the simple practice of the O-ring test and find somebody to sparring with, to practice with, and to become good at it. And then I can take you very, very far with what you can do with this. And, you know, our future looks pretty murky. Future of the planet looks pretty difficult. You know, right now we are observing, I like to say that here, that Europe is drying or dying in a drought, whereas England has created beautiful modification of the weather to has created some beautiful rain when it was needed. But that rain comes at a cost that the high winds that usually bring the clouds over the rest of Europe are forced to rain to empty all their water over England, and there's nothing left for the rest of Europe. And so it's a political issue that I'm smelling here, that forces Europe onto its knees. But the future of the planet doesn't look very good right now in terms of the climate and the famines that will follow and the water shortages and all that. And so having the O-ring test and having the ART system under your belt will largely make you independent and free of fear. You will always find good solutions when you have the right tool. And I'm willing to give you those tools. So good night.
Okay, so I think I should wrap up then. So thank you very much all for being there. I'm still watching loads of chats coming in and saying thank you, thank you, thank you, even come to Ireland, etc. There was a couple of messages particularly for me that I thought I should just mention. I just want to say thanks to James for mentioning that I should switch my microphone audio off before trying to play the video. So I apologize for that. And also Andy Loha said, actually, he found this on the Zoom. You cannot play the computer sound, cannot be shared whilst multiple screens are being shared. So obviously we did something wrong. However, hopefully I've rectified this, because I've actually added both the replay from last week, ART Module 1, into the bonus page, and I've also added the O-ring test into the bonus page as well. So the bonus page, for those that can remember it, is, let me actually, I've done this on that share screen as well, is klinghartinstitute.com/webinar special. Okay, so say that again, klinghartinstitute.com/webinar special. And I'm just looking for the, I've actually changed it. There we go. This page. Oh, I did have it in the background. So let me just share that with you here as well, just so you can share screen. And hopefully you can see my screen now. And hopefully that's all you can see. Am I right? Someone speak to me?
Yes.
Yes, good. Okay, so there's the URL. That's all I need to say. And thank you for Daniela for doing all the little chats in the background. And thank you for Dr. Klinghardt, who's gone way above and beyond our 1 hour and wanted to give all that extra time and bonus. And I have to say, I've been watching both Facebook live stream and the Zoom chat at the same time, and we didn't lose anybody. So actually 100% of the audience stayed with us. So bless you all. Thank you all for staying up out of bed as well. And thank you for Dr. Klinghardt giving as much as he did. And bless you. Thank you. I'll stop now.